Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published in September 2023 that we hope might be of interest to the VieSID community. So let's begin. Inege-Odio, Arcob et al. Published a paper where they discussed the possible iatrogenic effects of fixed retainers and showed a series of representative cases. Besides the high failure rate because of partial or full detachment, the authors discuss the possibility of undesired tooth movement noticed in the medium and long term by showing 9 cases, including subjects between the age of 19 and 48 years, that were examined after a variable number of years spanning between 5 and 33, over which there were maxillary or mandibular fixed retainers. These subjects showed unwanted tooth movements, including twist and the X effect, incisal cant, midline shift, open bite, mesial tipping, and torquing. The authors pointed out that these sorts of tooth movements can lead to fenestration and bone loss, gingival recession, and buccal dehiscence up to tooth avulsion. They concluded by stressing the fact that there are no standardized protocols for the use of fixed retainers, while this kind of intervention should require close monitoring. Benson et al. Published a scoping review in EJDO about the consequences of premolar extraction as part of the orthodontic treatment. After screening the literature, they considered 399 articles dealing with 8 main areas of research. The topics were ordered from the most to the least represented, and the outcomes of the research were condensed in short summaries. First topic, aesthetics, represented by 147 articles. These articles reported minor aesthetic changes. Cephalometric works reported significant changes in the cephalometric values, but probably due to the orthodontic treatment rather than the premolar extraction. One article reported shorter treatment times in the non-extraction group. Occlusion changes and occlusal stability, 105 articles. These papers consider factors such as relapse of open bite, which didn't differ between the study and control groups, and anterior crowding that seemed to be higher in the extraction group. Eruption of second and third molars, 43 articles. Outcomes for this area of research were unclear, as the articles were of low quality or reported on changes of inclination rather than on the ability to erupt. Effect on TMJ-TMD, 43 articles. These papers analyzed concluded that there was no association between premolar extraction and temporomandibular disorders. Adverse periodontal outcomes, 22 articles. These seem to indicate higher apical root resorption in case of extraction, but evidence was not striking and the duration of the treatment was not controlled for. Airway changes, 13 articles. Conclusive results were not possible because of the heterogeneity of the data and methodological limitation of the studies. Treatment duration and satisfaction, 10 papers. More than one article found that the treatment duration was shorter in the non-extraction group. Effects on the bone, 3 papers. Again, for this area of interest, research was inconclusive. So the authors concluded that there is insufficient or unclear evidence about the clinical effects of premolar extraction. Since this literature review included papers published until February 2022, the authors missed our article, the article by Londonio et al., that was recently published in the European Journal of Dentistry, in which we show that premolar extraction does alter mandibular kinematics. So I invite you to take a look at this open access paper. Taoli et al. Published an article on the Archives of Oral Biology investigating enamel and dentin mineral concentration and density in various primate species using microCT images. They consider 16 lower molars from as many species of great apes, including gorilla, chimpanzees, and gibbons, and various cercopithecine species like macaque or baboons. The analysis was performed for the 4 main cusps. So they found out that all of these primate species show the same pattern of mineral concentration and density of the enamel and dentin. In particular, mineral concentration and total effective density values were higher in areas of thicker enamel, while the opposite was observed for dentin. Buccal positions had significantly higher values than lingual areas. Cuspal positions had higher mean values than lateral enamel for both the dentin and enamel. Mesial enamel had significant lower values than other locations. Thus, they concluded that these common patterns across canine taxa may be linked to functional adaptations related to optimization of mastication and tooth protection. Giroux et al. Published a work in Elion, exploring the effects of occlusion and malocclusion on postural stability. They considered 16 patients with normal occlusion and 10 with class 1 malocclusion and measured the sway on a stabilometric, so a force platform, which looks like this, recording linear distances from the podal center of pressure. The acquisition time was about 50 seconds and the visual target was positioned at 90 centimeters. 5 mandibular positions were considered: the freely chosen, rest position, maximum intercuspation, and the right and left eccentric occlusion, in which the mandible was shifted laterally to reach edge-to-edge occlusion on both sides. Each position was collected with the patient looking straight ahead, once with vision and once with the vision blocked by a mask. Every measurement was collected once. In this box plot, you can see the sway areas by mandibular position. The authors noticed that with regard to eccentric occlusion, a difference was always present between the two sides. So the difference between the side with least eccentric occlusion sway and the side with maximum occlusion sway was significant. When considering the outcomes with and without vision, the authors found that the sway was significantly higher without vision, while with vision, the mean length of the sway was higher in ICP and on the side of maximum eccentric occlusion, while these differences were not noticeable anymore without vision. When considering the presence of malocclusion, normal occlusion patients tended to adapt more anteriorly with their weight. The highest sway with vision was recorded for ICP. Now, I would like to draw your attention to the S2K guidelines for instrumental functional analysis and registration of maxillomandibular relationship in dentistry that were issued by the German Society for Functional Diagnostic and Therapy, DGFTD for their German name, and are published in the Journal of Craniomandibular Function. These guidelines were elaborated by a team of 14 experts and pointed out the advantages and clinical applications of functional analysis for 5 main types of approaches, consisting of instrumental movement analysis, condylar position analysis, jaw relation recording, phase post-transfer, surface electromyography of the masticatory muscle. I recommend reading these guidelines, which provide information about the clinical suitability of these tools and recommendation for the best application of these diagnostic approaches in a clear and honest way. Del Cagno et al. Published a review of the articles on the use of botulinum toxins for TMD treatment. This article is to be found in the Journal of Craniomandibular Function. They considered randomized clinical trials, and the screening of the literature from 2000 to 2021 resulted in 24 articles. These were scored as level 2 articles on a scale from 1 to 5, where level 1 is considered robust evidence and level 5 includes opinion papers and case reports. So a level 2 means that the selected papers used samples with sizes smaller than 100 and had wide confidence intervals. So in these works, a variable dosage of botulinum toxins ranging from 25 units to 300 units was used. Injection was performed in the masseter, temporalis, and medial and lateral pterygoid, and was guided mostly by muscle palpation, and in some instances by electromyography or ultrasound. In these articles, the botulinum toxins was used to address myofascial pain and myospasm in 9 articles, TMJ articular disorders in 4, effects of bruxism in 8, and masseter hypertrophy in 3. Collectively, the papers included a total of 698 patients, 411 of which were treated with botulinum toxin. So the authors pointed out that these studies currently available on the use of botulinum toxins for the treatment of TMD do not provide satisfactory evidence on the validity of this intervention. The studies had small sample sizes, with only 4 of the 24 considered using more than 30 participants. They attributed this limitation to the high cost of the treatment, the short-term nature of its effects, and the absence of approved guidelines for botulinum toxin injections. Some studies showed evidence of myofascial pain reduction, but others did not corroborate these results. Also, there was an indication that botulinum toxic injection helped relieving the effects of bruxism, but by reducing muscle forces during bruxing activity, but not the number of bruxing events. Evidence for positive outcomes in the treatment of masseter hypertrophy was found. Instead, there was no evidence that botulinum injection could be useful in treating TMJ articular conditions. The authors stressed the need for further clinical research on the topic. However, I want to make 2 observations here. First, given the orthopedic nature of TMJ articular condition, one has to first ask whether botulinum injection is appropriate at all. Experimental research, and this is my second point, on animal models demonstrated the detrimental effects of botulinum injections both on the soft and hard tissues. Thus, I think this evidence cannot be neglected while making clinical decisions about the use of botulinum toxin injections. For example, with our screening on the sample of articles from the literature of September 2023, we found a paper by Liu et al. In the Journal of Oral Rehabilitation investigated effects of botulinum toxin injection on mastication, muscle forces, and bone density of the mandibular condyles. While in most animal studies, animals are injected unilaterally so that one side is the study sample and the other represent the control, in this study, the authors wanted to test the effects of bilateral botulinum toxin injection to explore its effect on masticatory function. They considered 19 rabbits, of which 10 were the study sample, receiving 10 units of botulinum toxin per masseter. Instead, the 9 control specimen received injection of saline solution. Half of the sample was euthanized at 4 weeks post-injection in the atrophy phase, while the rest was euthanized at week 12 in the recovery phase. Muscle activity was measured at baseline, and at 48 hours, 1 2, 3, 5, 7, 9, and 11 weeks after injection using intramuscular electrodes. Afterwards, the rabbits were euthanized and the condyles were micro-CT scanned to investigate bone health and density. Liu et al. Found out that masseter mass decreased significantly and the degeneration of the muscle fibers was noticed, while the surrounding muscles, not injected, were not significantly affected. The incisor force decreased, the duration of the chewing cycle increased, and the rabbits started to lose weight. In fact, they had to be fed with a gel to regain some weight. Masticatory movements became more erratic. Osteopenia was noticeable in the rabbits receiving botulinum toxin. Differences between the control and the study groups were significant at 12 weeks. This study shows the detrimental effects of botulinum toxin in both the soft and hard tissues of the injected areas. Importantly, these effects were noticeable in the recovery phase, thus indicating that studies on the subject would be informative if performed with a long enough observation time. Also, these outcomes should represent a warning to clinicians resorting to botulinum toxin. The September issue of the Journal of Oral Rehabilitation is particularly interesting as it collected a series of clinical and experimental articles, mostly focused on temporomandibular disorders and orofacial pain. It included original articles discussing the etiology, prevalence, epidemiology, and interventions, as well as reviews and commentaries. Among these reviews, we have selected a paper by Minervini et al. This review is assessing the validity of the protocols for conservative treatment of TMJ condylar fractures in comparison to a surgical approach. The conservative approach most commonly used was physiotherapy followed by maxillomandibular fixation, which was evaluated against open reduction and interval fixation. The conservative approach is considered safer with respect to surgery because of lower overall morbidity, risk of ankylosis, and avascular necrosis. The surgical approach seemed to lead to better occlusal outcomes, but also some long-term adverse effects were noticed, such as pain, arthritis, and open bite. A mandibular deviation and inadequate ramus height resulting in dental ankylosis and malocclusion were also noticed. Minervini and colleagues screened for review articles published in the last 23 years in which the two approaches were evaluated. Eventually, they considered 4 papers and the table showed here. These articles collectively considered 386 fractures of the TMJ, of which 195 were treated conservatively and 191 surgically. In these papers, the clinical outcomes were evaluated in terms of occlusal status, angle class, vertical height, maximum opening, and TMJ function, and time required for improvement of patient condition. As for the conclusions, variable outcomes were shown between the papers. So Kolk et al. 2020 concluded that the use of non-surgical treatment reduces complications. Ishiyama et al. 2007 concluded that no difference between the two approaches were found. Merler et al. 2018 said that the results were similar, but the surgical approach was to be preferred. Throckmorton et al. 2000 concluded that mandibular movements towards the fracture side improved more quickly with surgical treatment. Based on the conclusion of the authors, the non-surgical approach seemed to be recommendable as it led to similar outcomes as the surgical approach, but with fewer associated risks and complications. We've come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.